Have you ever looked at your arm in the mirror, maybe while pulling on a sweater or brushing your teeth, and noticed something new? A small spot, a strange color, skin that feels thinner than you remember. And you wonder, was that always there? Most of us chalk it up to age. Sunspots, wrinkles, dryness. It all seems normal after 60. But what if your skin was trying to tell you something more? Something deeper. Linda, 73, always thought she had sensitive skin. Red patches would come and go. Her legs were always a little dry. But when a strange rash developed behind her knees and wouldn't go away, she finally mentioned it to her doctor. What she found out surprised her. It wasn't just a rash. It was her liver quietly in distress. Then there's Thomas, 70, who noticed a dark mole on his shoulder while showering. It had been there for years, but now it seemed different. Slightly raised, irregular around the edges. A bit itchy. Still, he ignored it until his wife saw it and insisted he get it checked. It turned out to be melanoma, caught just in time, and it probably saved his life. These aren't rare stories. After 60, our skin becomes thinner, drier, and more reactive. But more importantly, it becomes a messenger for what's going on inside. Circulation, hormones, liver and kidney function, blood sugar, immune system, even certain cancers. Because your skin isn't just a barrier, it's an organ. And when something's wrong inside, it often shows itself outside first. The problem? Most people over 60 ignore early skin signs because they seem minor, cosmetic. But those signs can be the very first clue that something serious is happening deeper within the body. That's why today we're going to look at 4 skin signals that should never be ignored, especially after 60. This video isn't about fear. It's about awareness. Because spotting the right changes early can lead to better outcomes, simpler treatments, and most of all, peace of mind. We'll explore what to look for, when to take action, and how small changes in your habits can make a big difference. Let's begin with the first one. It's something that hides in plain sight. And for many, it starts as a single, small, reddish-brown spot, but can turn into something far more serious if you don't pay attention. Let's talk about new or changing skin lesions. It started with a tiny patch behind Thomas's ear. Carol, 76, never had skin problems. No eczema, no allergies, no reactions to soaps or lotions. So when her arms and legs started itching every evening, she figured it was just winter dryness. She applied lotion, changed her laundry detergent, but the itching didn't stop. It got worse. At night, she'd scratch without realizing it, waking up with red patches on her calves and arms. She didn't want to make a fuss, so she waited weeks before saying anything. When she finally saw her doctor, they ran some labs. The results? Her kidneys were struggling. The itching was a warning sign, long before any pain appeared. This isn't uncommon. After 60, it's easy to assume dry, itchy skin is just a part of aging. And yes, aging does thin the skin, reduce oil production, and affect how moisture is retained. But when dryness becomes chronic, or itching doesn't respond to moisturizers, it could point to something deeper, which should raise a red flag. Itching that persists for more than 2 weeks, especially without a visible rash. Worsening at night. Itching on the back, arms, scalp, or lower legs. Cracked skin despite moisturizers. Scratching that leads to small sores or scabs. These symptoms could indicate 1. Kidney disease. Itching, especially on the back and arms, is a common symptom in early kidney problems. Your kidneys filter waste, and when they slow down, those waste products irritate the skin. 2. Liver disease. Liver dysfunction can lead to bile salt buildup in the skin, causing intense itching, sometimes without any visible change. 3. Diabetes. Poor circulation and nerve damage in diabetics often cause dry skin and itchy feet, legs, and hands. 4. Thyroid imbalance. Both overactive and underactive thyroid can cause skin dryness and increased sensitivity. 5. Iron deficiency or anemia. Low iron affects skin oxygenation, often leading to itchiness or pallor. So what can you do? First, look for patterns. Does the itching get worse at night? Is it only in one area? Are you using more moisturizer with no results? Second, stay hydrated from within. Drink water consistently. Many older adults drink less than they think, and dehydration worsens dryness. Third, switch to gentle skincare. Use unscented, alcohol-free moisturizers like CeraVe or Eucerin. Avoid hot showers. Use lukewarm water and pat skin dry instead of rubbing. Fourth, don't delay labs. If the itching is persistent, see your doctor and request tests. Kidney function, BUN, creatinine, liver enzymes, blood sugar, A1C, thyroid panel, iron levels. Carol never imagined her itchy legs were related to her kidneys. But catching the issue early allowed her to adjust her diet, medications, and protect her kidney function before it worsened. Now she checks in on her skin every morning, not to judge it, but to listen to it. Because skin doesn't just age, it speaks. And sometimes, what seems like just dryness is actually your body saying, I need help. Let's move now to the third skin signal, one that many people treat like a cosmetic nuisance, but can actually be a warning from your blood. Let's talk about easy bruising and unexplained discoloration. At first, he thought it was dry skin. It flaked a bit, felt rough. He rubbed a little lotion on it and moved on. But weeks passed, and the patch stayed. Then it darkened slightly, a little irregular around the edge. Still painless, but different. He told himself it was nothing, maybe sun damage. Then one day, his wife noticed it and frowned. You should get that looked at. That visit saved his life. The dermatologist called it a textbook warning sign. Asymmetrical, uneven color, raised border, slow growth. It was melanoma, and it had just started to dig deeper. Skin cancer doesn't always look scary. It often starts as something so ordinary you wouldn't even give it a second glance. A freckle that gets darker. A mole that's been there for years, but now it's itchy. A red bump that bleeds when you dry off after a shower. A crusty patch you keep scratching at without realizing. After 60, the risk increases dramatically. Why? Because the skin has been through decades of exposure. UV rays from years of yard work, driving, beach trips, thinning from hormonal changes, slower cell repair, and often less awareness of small changes. And it's not just melanoma. There are other skin cancers that often go unnoticed. Basal cell carcinoma often looks like a pearly bump or flat, flesh-colored patch. Slow growing, but destructive. Squamous cell carcinoma, rough, scaly, reddish patches that may bleed or crust. Often appears on ears, face, scalp, or backs of hands. Actinic keratosis, not cancer yet, but a precancerous lesion that needs to be treated early to prevent turning into squamous cell cancer. So how do you know what to look for? Use the ABCD rule for moles and spots. Asymmetry, one half doesn't match the other. B, border, irregular, scalloped, or poorly defined. C, color, different shades of brown, black, pink, or even blue. D, diameter, larger than 6 millimeters, about the size of a pencil eraser. E, evolving, any change in size, shape, color, or behavior, like bleeding or itching. But here's the twist. Even flat spots can be dangerous. Even lesions that don't hurt can be serious. Pain is not the only alarm. So what can you do? First, check your skin monthly, especially areas you don't see every day: back, scalp, behind the ears, underarms, soles of your feet. Use a mirror. Ask a loved one. Take photos if needed. Second, take photos of anything suspicious. If something changes, you'll have a record. Doctors love that. Third, schedule an annual full-body skin exam, even if you have no concerns. Prevention is better than treatment. Caught early, most skin cancers are highly curable with simple procedures. Fourth, wear protection. Broad-spectrum sunscreen, hats, sleeves, even on cloudy days. Sun damage is cumulative, and your skin never forgets. Thomas never imagined a rough little patch could turn out to be something so serious. But because he caught it early, the treatment was simple. Quick surgery, no spread, no chemo, no radiation. He still checks behind his ears every week now. Because once you realize your skin can warn you before it's too late, you never stop paying attention. Now let's move to the second sign. This one even more overlooked because it doesn't look dangerous. Let's talk about persistent skin dryness and itching and what it might be telling you about your internal health. Richard had always been an active guy: golf, gardening, fixing little things around the house. But lately, his arms and hands were covered in bruises, and he couldn't remember bumping into anything. At first, he brushed it off. Must have nicked myself on the shed door, he'd say. Or maybe I leaned on something rough. But the bruises kept coming. Big, dark, and sometimes yellowish. And one day, he noticed one stretching from his elbow down to his wrist, without any pain, without any trauma. That's when he knew something wasn't right. Here's what most people don't realize. As we age, our skin becomes thinner and blood vessels more fragile. The padding under the skin, fat and connective tissue, diminishes, meaning even a small bump can lead to noticeable bruising. But when bruises become frequent, large, or appear without any clear cause, your skin may be pointing to a deeper issue. What should raise concern? Bruises that appear spontaneously, especially on arms, legs, or abdomen. Spots that look like blood under the skin, called petechiae or purpura. Skin that discolors easily, even with light touch. Bruises that last more than 2 weeks or seem to spread. Possible underlying causes include blood thinner medications, aspirin, warfarin, Plavix, or even fish oil and vitamin E in high doses can increase bleeding tendency and cause skin bruising. Vitamin deficiencies. Vitamin C deficiency weakens blood vessels. Vitamin K deficiency impairs clotting. Low B12 or folate can affect capillary strength. Liver disease. The liver produces clotting factors. When compromised, bruising increases. Platelet disorders or low platelet count. This may result from autoimmune diseases, medications, or even bone marrow changes. Leukemia or blood cancers. While rare, persistent unexplained bruising, especially with fatigue, pale skin, or bleeding gums, needs urgent evaluation. So what can you do? First, monitor patterns. Keep a log. Where are bruises appearing? Are they symmetrical? Do they happen after activity or overnight? Second, check your supplements. High doses of fish oil, turmeric, garlic, or vitamin E can thin the blood. If you're already on blood thinners, this can compound the effect. Third, talk to your doctor. Ask for labs including platelet count, coagulation profile, PT/INR, liver enzymes, vitamin C, K, and B12 levels, complete blood count, CBC. Fourth, protect your skin. Wear long sleeves when gardening or cleaning. Use cushions and armrests around the house. Moisturize daily. Hydrated skin is more elastic and less prone to tearing. Richard's tests revealed a mild vitamin K deficiency worsened by his long-term use of a blood thinner. With a few adjustments, diet, safer supplement combinations, and regular monitoring, his bruising decreased dramatically. And the anxiety that came with seeing his skin so marked, that eased too. Because sometimes what we see on the surface is a visible clue that something underneath needs balancing. Now let's move to the final skin signal. One that's quiet, sometimes almost invisible, but has the power to reveal some of the most serious underlying threats. Let's talk about changes in skin tone and color, especially yellowing or darkening. Marie always had fair skin. Her cheeks would flush easily. Her complexion was naturally warm. So when she noticed her face looking duller in the mirror, she figured it was the lighting. But over the next few weeks, her skin began to look grayish. Her eyes seemed a little yellow, and the area around her mouth, just off. Her daughter noticed it first. "Mom, are you feeling okay? Your skin looks kind of different." Marie was feeling tired lately, nauseous in the mornings, but she thought it was just age. Her doctor ran blood tests. The results came back: early-stage liver dysfunction. The skin had shown the signs first. You see, skin tone and color changes are one of the most overlooked red flags, especially in older adults. We think we just look tired, or pale, or off. But those color shifts can indicate serious conditions developing inside. Here are the main skin tone changes that should raise concern. Yellowing of the skin or eyes. This is called jaundice and often signals liver problems, like hepatitis, bile duct obstruction, or liver failure. It can also result from certain medications. Pale or grayish skin could mean anemia, low red blood cells, poor circulation, or heart/lung issues. It may also reflect malabsorption of nutrients, like B12 or iron. Darkening of skin folds or creases, dark, velvety patches, especially on the neck, underarms, or groin, could indicate insulin resistance or type 2 diabetes, a condition called acanthosis nigricans. Blue or purple tinge to lips or fingertips. This may signal low oxygen levels due to heart or lung disease. General dullness or loss of radiance, often linked to dehydration, poor nutrition, or kidney strain. So what should you watch for? Skin that changes tone, not from sun, but gradually over weeks. Eyes that lose their brightness or turn yellowish. Skin around the mouth or hands that appears bluish, gray, or unusually pale. Patches of darkness in areas that were once even-toned. What can you do? First, don't rely on lighting. Check your skin in natural daylight. Bathroom mirrors can lie. Second, listen to other people's comments. If someone says you look different, don't dismiss it. They may be seeing something you've gotten used to. Third, take photos weekly. It's hard to see gradual change. A picture is often more honest. Fourth, ask for a full panel of labs. Liver function, AST, alt bilirubin, iron, ferritin, B12, A1C, and fasting glucose. Kidney function, oxygen saturation. Marie started treatment early. Her doctor adjusted medications, changed her diet, and within 2 months, her skin tone returned. But more importantly, she felt like herself again. Because sometimes the mirror sees what we won't admit. So now, let's bring it all together. Your skin is not just a surface. It's a messenger, a reporter, a gentle alarm bell. And after 60, it becomes one of the clearest reflections of your internal health. Here are the 4 skin signals you should never ignore. 1. New or changing lesions. Spots, bumps, or moles that change in shape, size, or color may be early signs of skin cancer or deeper immune problems. 2. Persistent dryness and itching, especially if lotions don't help. This may point to kidney issues, liver dysfunction, or diabetes. 3. Easy bruising and unexplained discoloration. Could reflect vitamin deficiencies, blood disorders, or medication interactions. 4. Changes in skin color or tone. Yellowing, grayness, or dark patches may indicate liver disease, anemia, diabetes, or circulation problems. And the good news? You don't need to be a doctor to catch these signs. You just need to slow down and pay attention. So here's your invitation. Check your skin every week. Ask someone you trust to look at areas you can't see. Don't wait for pain to take action. Bring up changes, even small ones, at your next checkup. And remember, your body speaks. The skin is its voice. If this video helped you see your skin in a new way, let us know in the comments. Have you ever noticed something that led to a diagnosis? What's one thing you'll start checking more often? And don't forget to like this video, subscribe to our channel, and share it with someone who needs to hear that looking in the mirror could save their life. Thanks for watching. Stay aware, stay well, and we'll see you in the next one.